open Texas. So she's wow. Okay, so let me ask you a couple of things that I think our listeners would love to know. Talk as long or short as you like on it. All right, so tell us what you think about we're hearing this in the news. I know we're keeping up with it on our side, but these digital immunization passports, what's your opinion on those?
Well, first of all, I remember the days of having to have a yellow card, immunization card in our passports when we traveled overseas. My husband and I were scuba divers, and we traveled all over the world. A lot of third world countries have great dive sites. And so we traveled with a smallpox vaccination and other immunizations. We traveled with the card early on that described what immunizations we had. So the concept has some precedent. To have a requirement of that for all travelers is orders of magnitude more intrusive. I mean, we could choose in those days, if we didn't want immunizations or if we didn't want to have to deal with getting shots, we could choose not to take that trip because there were limited places that required it. But to require that across the board for all travel, I think is a violation of civil liberties that is not appropriate or necessary, because we have effective treatment. Look at the fact that all of these other countries, and some of them are third world in terms of their medical infrastructure, they've gotten much better outcomes already with COVID-19 than we did simply by using an old, cheap, safe drug and using it early. I mean, hydroxychloroquine cost something about, depending on the source, between 37 and 63 cents a tablet. You can do the whole course of treatment for COVID-19 of 5 to 7 days for probably less than about 10 bucks. So it's not a cost issue, and it's widely available. We have millions of doses sitting in the national stockpile. Governors were using it as an excuse of, oh, we have to protect the supply for the lupus and rheumatoid patients. That's not correct. They quickly, under President Trump's leadership, they had gotten donations of millions of doses within the first couple of weeks of this outbreak. He was up on top of the medical information. He knew that it was being done. And in fact, I've recently learned that it appears that even Dr. Hahn and President Trump were really unaware that Rick Bright had inserted that language into the emergency use authorization. Because
wow.
One of the press conferences I watched on Sunday at the end of April, I saw President Trump kind of hold his hands out and say, well, what's the problem? The FDA has approved it. And I thought at that moment, oh my God, he thinks the FDA approved it for all of the uses in COVID-19, inpatient and outpatient. And, you know, when you're president and you've got a million things coming at you constantly 24/7, you can't keep up micromanaging the language in every emergency use authorization that gets issued in a pandemic like this. I honestly don't think that the top people realized what Rick Bright had done until many of the doctors and people speaking out, patriot groups asking, why are we not having access to this older, safe, cheap, effective drug? I mean, the doctor in Texas that was so successful at keeping nursing home patients alive,
Dr. Armstrong,
did find a way to get hydroxychloroquine prescribed for his patients, even though other doctors in Texas have been sanctioned by the medical board and are being investigated for trying to use it because of Governor Abbott's restrictive order requiring it for hospitalized patients. And then on the pharmacy prescriptions, they issued a restriction that you had to have a diagnosis on the prescription. Well, that's a catch-22, as Dr. Lozano pointed out. First of all, it's an invasion of the patient's privacy. We don't require diagnoses on other prescriptions that we write for patients. And secondly, under the emergency use authorization, if you put that down, or the emergency orders, if you put down a COVID-19 diagnosis, the pharmacist probably won't dispense it because they'll say, well, it's not approved for COVID-19. So a doctor then is faced with a very serious ethical and licensing problem. If you put down another diagnosis, which is not true, you risk losing your medical license because you've lied. And if you put down COVID-19, the patient still probably won't get the prescription.
My goodness. Okay. I've got two more questions. I want to respect your time. I know you have 80 things going on today, but the final question is going to be, how can we help you get the word out? But the first question I wanted to ask is, okay, so we keep hearing, a lot of us are very disturbed because we keep hearing in Texas, Governor Abbott talking about tracing, but then also, hey, we want this, they're saying this, we want this vaccine made available and then everything will be good. And we're very uncomfortable with it. But what are your thoughts on that?
Well, first of all, we have not been able to develop a successful vaccine for HIV or SARS-CoV-1 in all of this time. To develop a vaccine for SARS-CoV-2, COVID-19 is a very challenging problem. And I am very concerned about the potential for serious side effects if it's rushed to market without adequate safety trial. And we cannot keep our country locked down until such time as we have a vaccine. That's just simply not possible. It's not medically necessary. It's not medically wise. We need to have people developing herd immunity, which is a whole nother subject, and require.
We'd like to have you back for that one.
Look at the model from Sweden, and you'll see how important that is. But we've got to be careful about that, because the vaccines, we know, have many beneficial uses, but there also are problems and side effects. And when you start mandating a medical treatment across the board for all patients, that is an intrusion in medical practice, in the laws governing medical practice. It's an intrusion into patient civil liberties, and it's a risk because people react differently. And it smacks of the totalitarianism of the Soviet Union, the Iron Curtain countries under the Soviet Union, communist China, communist North Korea. All of the totalitarian states use mandatory medical treatment approaches to control the population. And I don't think any of us in the United States living under our Constitution really want to see us go down the road of mandated medical interventions.
We sure don't. Okay, so we're just about out of, oh, go ahead.
Let me answer your other question.
How can we help you?
I really want people, share the editorials, call your legislators, get this word out on social media about the safety. We are the media now. It is very clear that the mainstream media is and the social media giants are censoring information medically that is accurate but doesn't fit their narrative. People need to download these videos to their own computers, share it among their friends and their network, get to talking it up among people in your circle, start the grassroots effort, lobbying the legislators. For Texas to open more safely, we need, and I've written a letter, a personal letter to Governor Abbott this week. I did not have a reply yet, but I wrote him a personal letter at the suggestion of some business people in Texas and sent it personally, FedEx, with data and my letter saying, and some of my editorials saying, here's the information. You can make the opening safer if you allow people's primary care physicians to have access to this medicine without intrusion by the pharmacist, by the state medical boards, and by politicians restricting their medical judgment. We need help getting that through the governor's office. If he took that step, then you do as India did. And I sent him the India guidelines. If we do as India did, make it available prophylactically for our doctors and nurses, if someone can choose not to take it, but we need to have that be a choice. We can't have it be politically restricted. So get that accomplished. If Governor Abbott could see his way clear to take that and have Texas lead the nation on adding this aspect of safety to the social distancing, the disinfectants, all of the other things that we've been doing, add the option of personalized medical care from your physician with hydroxychloroquine, either prophylactically or early when symptoms begin. Don't restrict it to hospitals. That would make it safer medically, based on everything I've seen from around the world and my own patients and other doctors in the United States, to open our businesses and get people back to work. Give them that therapeutic tool available to be used appropriately with their physician.